On this clinical insight, we are going to talk about isometrics, and this insight is just a much abbreviated version of a longer conversation that happened with Dr. Keith Barr, I believe of UC Davis, on the Tim Ferriss Show, where they really dove into a bunch of different aspects of health and tendon health that we aren't going to necessarily cover here, but we thought that would be interesting to share along. And so Dr. Keith Barr has really focused on tendon in research, and with that, isometrics and everything that goes along with it. So we wanted to highlight some of the main things. And honestly, it was really interesting for me in that they started off talking about a world caliber rock climber who wanted to strengthen up his hands, and that really it would only take 10 minutes a day to do that by strengthening up the tendons within the hands, and i.e. everything else that comes along with it. And what they found is that tendons get signal and adapt for about 10 minutes. After that, it loses it, and the rest is wear and tear. So really, this is the minimal effective dose when it comes to strengthening your tendons. So you can train the tendon again in 6 to 8 hours, again with this 10 minutes of work. And what the bottom line recommendation is when you're doing these isometrics on healthy tendon, 10 seconds on, 50 seconds off for 10 minutes is literally all the load you need to truly get some change throughout the entirety of the tendon. And that doesn't have to be super loaded extra weight, but definitely can be as you're working on training them. So a couple things on the background. So tendon is a mechanical tissue, and so the longer the isometric, the more evenly the cells get utilized to train them throughout. So you got to be aware of that when we're talking about some injury and different aspects of it, which we'll talk about here in just a little bit with some different timing aspects of it all. One thing that he was talking about is it's the quote unquote jerk that happens in a tendon, and where the rate of change of acceleration or the kind of the catch, or if you're hitting a ball and that ball, your arm is going one motion, think tennis racket, tennis elbow, and the ball is coming the other way, and you get this little jerk when that contact occurs and puts a little quick stress on the tendon, and that's ultimately what causes injury. Similarly, in an Achilles tendon tear, if it's that jerk of the super quick adjustment in rate of acceleration that can ultimately cause that tear. So that's going to be important when we come into some different types of isometrics here in just a minute. In the training data, i.e. Both strength training and rehabilitation, eccentrics were thought to be and are thought to be very important in terms of tendon rehab. And Dr. Barr makes the argument that really heavy training is the same as eccentrics, and it was determined that to be the velocity that is the importance of that. So when you take and in engaging the tendon with that slow velocity, i.e. when you do eccentrics, it's 3, 5, 10 seconds on the lengthening phase, and always go back to the bicep curls. This would be the lowering of the weight from your shoulder back down to a straight arm. That's the eccentric phase. But if you take the velocity down to 0, it allowed for greater load across the entire tendon. And so essentially the velocity at 0 is an isometric. So the eccentric part of that, thinking that it was the key component, was essentially a false positive. Nothing wrong with it, but isometrics are going to get you more for the work. So again, when we talk about the loading of the tendon, and we referenced this just a little bit earlier, healthy tendon, 1 to 10 seconds of isometrics to get the stimulus. In an unhealthy tendon, rehabbing an Achilles tendinopathy, a patellar tendinopathy, lateral epicondylitis, you name it, approximately 30 seconds is needed in order to get the changes that you want, because you're going to have to override some of the protective mechanisms that can be included in that from that injured tissue. So you really need to load it to almost fatigue out the good, in quote, fibers on an injured tendon in those first 10 seconds or so, to then convince the body with under that load to then recruit all of the fibers to make sure that you're truly loading it to create the change that you're wanting to. And I believe what the recommendation there is still no more than 10 minutes total of load, but you look at a 30 seconds of load with 2-minute rest in between, trying not to create pain, but just creating the stimulus. And we'll talk about that here in just a second. So really what you're trying to figure out, and when you're looking at this 10 minutes, is we want to get as much signal to that tendon as possible while also not increasing the wear and tear, especially when it comes to the rehabilitation process. Now, the types of isometrics, and this was a learning point for me too, hadn't thought of this, that he discovered were overcoming isos and yielding isos. And the best example he gave was using a leg extension analogy that you can apply to different aspects of exercise and body parts as well. But in an overcoming iso, which is the ones that he would recommend, is you're starting at the bottom of the leg extension. So knees are bent, loaded it up with weight, and you want to have it be where you cannot move that arm of the leg extension. So you want to start slow with your tension, build it up for about 3 seconds, and then hold for 30. And again, this is for injured tissue that we'd be focusing on. So we want to minimize that jerk where we're just firing in against it as hard as we can. We want it to be a slow build up to maximal tension and create that maximal signal, again, with no pain, but we don't actually want the movement to occur. That's an overcoming iso. Yielding isos is we're kicking out the bar with both legs to get our knees extended so they're straight. And then we're going to switch from holding with the 2 legs going down to 1 with resistance. This can create some jerk and potentially cause a rebound stress to that tendon, further injuring it, maybe not stimulating as much as we want, but we want to avoid that because that can create that jerk. We can potentially work our way to this, but be careful with these yielding isos, especially early. So you want to be careful not to introduce that jerk as much as you can. So really a couple other things put in there that we talked about is, we have to be careful that, flexibility, things like that aren't always the end all be all. And they use that a lot as a definition and an example of gymnasts. Women's gymnastics in collegiate has the highest rate of Achilles tendon rupture. And they are probably the most flexible. But there's a U-shaped curve where if you're inflexible, your injury rate goes up, and if you're hyper flexible, your injury rate goes up. So finding that balance of utilizing things like these isometrics to help strengthen those tendons can be really, really important. And you want to make sure that when we're doing these, we're focusing all different motions within that muscle. So for example, with the Achilles tendon, we're going to want to do straight leg and bent knee options because we want to include the soleus and its integration into the Achilles tendon. So again, really, I thought this was super interesting. The link will be to the full episode. Highly recommend digging into it because it's just a whole eye-opening thing for me on how I would change up doing some of the rehab I had in the past. But healthy tendon, 10 on, 50 seconds off for 10 minutes to focus on strengthening up those tendons all across the body. Unhealthy issues, unhealthy tendons, 30 seconds on, 20 seconds off. To help strengthen those. And again, for that specific protocol, you can start that pretty quickly after a surgery, even within a walking boot, because we'll create that stimulus, but we aren't creating that motion. And again, start easy, no pain, anything like that, and then build that up from there to help increase that tendon integrity and get the healing process started. So highly recommend you check out that podcast. Hope this gave you an insight to maybe test out on yourself or in your clinic, and we'll catch you on the next episode.